I'm Jack Klobnak. For the next few minutes, we'd like to introduce you to MarketVision, its program, and its staff. MarketVision is the ophthalmic marketing subsidiary of Neiman Marcus and Canefield, a St. Louis-based medical marketing agency. Our company handles marketing for many hospitals, HMOs, PPOs, and other healthcare-related clients. Recently, we concluded that many ophthalmic practices were realizing the need for the services of a full-service marketing agency in their cataract and refractive surgery campaigns. We created MarketVision to address these needs. Ben Neiman talks about the decision to found MarketVision.
We started MarketVision to respond to the needs that were in the environment for the individual practitioner. Doctors all over the country need some answer to the problem that are facing them regarding HMOs, DRGs. They're sitting out there watching their profession dry up, and we're here to help them in a professional, appropriate manner respond to that and do something about it.
Sharing the high cost of the creative vehicles with other practices in non-competing markets allows your practice to begin your marketing campaign immediately and at an affordable price. A good question is, what's the difference between MarketVision and other syndication-type companies? It's true, other companies offer syndicated commercials, but MarketVision also provides your practice with access to the rest of the services provided by a full-service marketing agency. In order to examine these services, let's take a look at the structure of MarketVision. MarketVision consists of 4 departments. Account Services, which includes account executives and supervisors, your contact with the agency. Your account executive will conduct regular meetings with you to determine your needs and will, when necessary, access the other departments of the agency. The Creative Department consists of artists, copywriters, and designers. The Creative Department is charged with producing professional, appropriate, and effective advertising vehicles. This is an ongoing process at MarketVision. We will continue to produce new materials which will be available for your use on a regular basis. The Media Research and Buying Department conducts the research of your market and all available media, selects the proper media, and negotiates the best price. Our public relations staff will work with your practice to try and develop news articles, talk show interviews, and public speaking engagements, and integrated advertising and public the success of your campaign. Each of these departments works together to provide an integrated marketing program for your practice. Creating the messages that will represent your practice is done with the highest level of respect for your professionalism as a physician. Paul Maring is our creative director.
Well, there's some special considerations that you have to take into account when you're dealing with medical marketing and the medical practices. You're not only creating advertising that you're trying to have an effect on, that you're trying to get to come into a clinic or respond to the peers of the people who are advertising. And so you have to be very concerned about how professional the ads are, about the appearance of them, and that there's nothing in them that is in any way offensive.
With so many options available, it's sometimes difficult to decide which media to use. MarketVision subscribes to the multimedia philosophy. Our programs consist of television, radio, print, direct mail, and public relations. This is not to say that we always recommend every media for every practice. We usually don't. It's only after a thorough examination of your market, the available media, and most importantly, the needs of your practice that we make our recommendations. Martha Mick explains this process.
Being a full-service advertising agency, we have the resources to tap information about specific media in any market. Within a day, we can have a handle on what television, radio stations, as well as newspapers exist. We then take those stations and newspapers and analyze them in terms of their cost efficiency in reaching our target audience. We also look at competitive activity to just get a feel for what the competitors are doing. Our access to rating services and the marketing representatives give us a handle of what's going on in the market, which is an invaluable tool in making a wise media buy.
At MarketVision, we believe ads should be product specific. That is, targeted towards a specific procedure like radial keratotomy and cataract surgery. For example, many ophthalmologists have found that addressing the cost factor is very effective in reaching cataract patients.
If you're experiencing blurred or cloudy vision, having trouble driving or watching television, you may have cataracts. Many older folks put off treatment of cataracts because they're afraid of the cost. If you're over 65 and on Medicare, you may qualify for virtually free cataract implant surgery. Your sight is so precious, and there's still a lot to see. Call now to schedule your free cataract examination. Don't put it off. Call today.
Here's the companion radio commercial.
If you're 65 or over, this is important news. Millions of older Americans suffer from cataracts. Cataracts are the leading cause of blindness in people over 60. Yet many people put off surgery that could restore vision because they worry about the cost of medical care. Here's good news. At the Cataract and Implant Institute at Deaconess Medical Office Center, outpatient cataract and implant surgery cost Medicare recipients nothing beyond the annual $75 deductible. Usually, the procedure takes about 40 minutes and requires no hospital stay. There is no financial reason to put it off. You paid into Medicare. You're entitled to its benefits. Vision is too precious to waste. Get a free cataract screening examination now.
Find out more about cataract surgery today. Call the Cataract and Implant Institute at the Deaconess Medical Center. The number is 531-4104 or toll free in Illinois, 1-800-645-0023.
Each commercial can be customized for your practice. We believe ophthalmology ads should be very direct, very educational, and very effective. Watch this.
If you're nearsighted or have astigmatism and have a problem wearing contacts or glasses, a new microsurgical procedure called radial keratotomy could make you less dependent on your glasses or contacts. Radial keratotomy can usually be performed on an outpatient basis in about 15 minutes. But radial keratotomy isn't for everyone, and your decision should be made after a complete examination by an ophthalmologist. Call now to schedule your eye exam. There's no charge for the initial consultation.
Our radial keratotomy radio commercials are designed to educate potential patients about the benefits of refractive surgery while still pointing out the possible risks.
Make a wish.
Okay, I wish you'd start picking up your dirty socks.
No. Wish for something impossible.
Impossible. Okay. I wish something could be done so I wouldn't have to wear glasses anymore.
Come on, I said wish for something impossible.
That is impossible. I've been nearsighted since the 3rd grade.
Well, it's not impossible anymore. There's a new microsurgical procedure called radial keratotomy, and I read where in most cases it can reduce or totally eliminate the need for glasses or contact lenses.
And you don't need glasses anymore?
No more glasses.
I don't know, though. Surgery.
Radial keratotomy takes about 15 minutes, and it can be performed on an outpatient basis. Some patients are back at work the next day. So go ahead. Wish for something impossible.
I already did.
But with radial keratotomy, you might never have to wear glasses again.
I'm talking about your dirty socks.
To find out more about radial keratotomy, call the Refractive Surgery Institute at Deaconess Medical Office Center. The number is 531-4104. There's no charge for your initial examination to see if RK is right for you. Call 531-4104.
Your marketing campaign will generate inquiries, but if your staff is not prepared to offer the right answers, qualified leads can disappear. Our MarketVision telemarketing counselor will work with your staff to ensure that all inquiries are properly processed and captured. Of course, the MarketVision program is exclusive. We accept only one client per market, and in what's becoming a very competitive marketplace, this is a very important factor to consider. Most importantly, at MarketVision, we understand that marketing is new and sometimes uncomfortable for many physicians. While creative and effective, our program addresses these concerns.
Well, I like to say that hospital advertising, the way it's been going, and medical advertising in general, is like the emperor's new clothes, that story by Hans Christian Andersen, where everybody thought that the king was well-dressed when he was really naked. And in fact, well-meaning people in advertising are called upon by well-meaning people in hospitals and in medical practices and asked to do advertising. So they do the same things they've done for years that work for dog food or beer or whatever. But in fact, what happens is they get on the air and they're not appropriate, they're not professional, they're kind of a slap in the face of the profession, even though they may attract people to it. So what you have is a lot of people saying, well, gee, that looks really good, that was creative, but it's inappropriate, and it's not right for a physician's practice or a hospital. So you have all these people nodding and saying, isn't the emperor really dressed well, when in fact he's naked, and you can't be naked.
Thank you for this opportunity to introduce you to MarketVision. We hope you feel you know us a little better. Since every practice is different, it's impossible to address every concern in such a short presentation. We would like the opportunity to discuss your practice marketing needs, plans, and goals. If you're interested in the MarketVision program for your practice, or if you'd like more information, call us collect. Our number is 314-727-9800. Thank you for your time.